Hi, welcome to City Vision University's Introduction to Christian Addiction Counseling course. I'm Andrew Sears, and I'm going to give you a quick overview of the course. So in this course, we're going to be going through two books. One is called Addiction Counseling, a Competency-Based Approach, and it aligns with the addiction counselor competencies from SAMHSA, and the other one is Counseling in Christianity, 5 Approaches. So let me just talk a little bit about the Christianity and Counseling, 5 Approaches. We're going to be going through 5 different approaches to, what's different about how Christian counselors do things, what are different approaches to that, and we're going to talk about biblical counseling, transformational counseling, Christian psychology, the integration model, and levels of explanation, which is largely a secular view of how you integrate spirituality. Now, the other book is going to go and focus particularly on the 8 practice domains of addiction counseling. And if you try to get certified in addiction counseling, you're going to need to have mastery of these 8 practice domains. Almost all the state and national certifications are focused on this. And there's the 8 domains, and then there's the transdisciplinary foundation. So these are the basic knowledge you need to be able to utilize those. Now, what we're really trying to do in this course is we're trying to provide Christian integration. So, how do you do Christian treatment planning? How do you do Christian approach to, all of these things? And that's really what a big part of this course is try to combine those. And the idea behind a Christian worldview is it's kind of like a lens of sunglasses that you take that's going to affect all these things. Now, the outcomes for this course, the first 3 outcomes are focused on the first book, which is the 5 Approaches to Counseling in Christianity. And what we're going to do is we're going to have you apply each of those approaches to a sample case. We want you to be able to reflect on your own values and those of an organization you're going to work for, to think about which model of Christian counseling might best fit in the various contexts and with various clients. And the 4th outcome is really focused on all the different competencies of addiction counseling and the 8 practice domains of addiction counseling. Now, even though the first 3 are 3 outcomes, the 4th one is going to be at least about half of this course. Now, if you go through the course and the different weeks in the course, so week 1 is just going to be an overview. Then in week 2, you're going to be doing assessment and treatment process for addiction. And we're going to have topics that are related to addiction counseling and topics that are related to kind of the Christian counseling. And we'll go through each of the 5 approaches. We'll cover co-occurring disorders and the integration model, relapse prevention, and Christian psychology. And these aren't going to be exactly related, but you can kind of apply the principles across them. Now, one of the things we like to emphasize is to do well in this course, you need to be spending about an average of 17 hours per week for every 3-credit course. That's an accreditation requirement that a 3-credit course should take 135 hours of activity. Now, the design of this course, you're going to be going through the book and the videos. We want you to take notes through that. And then what you're going to be doing is doing material summaries, live meetings, forums, and you're going to be doing assessment and treatment plans from each of the 5 perspectives. And then at the end, you're going to be doing a final paper. Now, one of the big things about this course is that because this is our 101 course, we're trying to help you understand kind of a guide to your career in addiction counseling. So we want you to understand what's the various paths? Where do you go? A lot of people in addiction counseling kind of get disappointed because they don't understand this. So this is something to really pay attention to. We're going to cover it in multiple areas. So some people will start off as a certified peer recovery or prevention specialist, but in most states, a lot of people will go directly to become a licensed addiction counselor. So that could be CAC1 or CAC2. And in some states, it's called licensed alcohol and dependency counselor. Now, in many ways, if you use the military analogy, if you're familiar with, there's the enlisted and officers. This is more like the enlisted. These are people that are closer to the community. But then you go up to the next level, which is master's level. And these three here, the LMFT, the LPC, and the licensed clinical social worker, in most states, you have to have that level to be able to practice counseling on your own. In many states, to be even called a counselor, you have to have one of those. But the most important part is to be able to bill to insurance or to Medicaid or things along those lines, or in a lot of states at supervision, you're going to need these. Now, in some states, they will allow the master addiction counselor to do that, but you want to be thinking about these in terms of your long-term career path, because there's going to be a big increase in pay and a big increase in demand in that. So part of the reason for that is if you understand a typical org chart of a licensed treatment center. Now, this isn't necessarily a Christian treatment center, but you need to understand how the rest of the industry works, even if you're at a Christian center. Often you'll have a psychiatrist or an MD that's over everything. And then that person will supervise licensed professional counselors. That person will supervise the master addiction counselor or the clinical supervisor, the addiction clinical supervisor. They will also supervise the licensed clinical social work, and then sometimes you'll have clinical psychologists. Clinical psychologists often can bill too. And then the third tier is the addiction counselors. So this is more the street level, and then below them is the peer specialist. So part of it is, as you move up through this, peer specialists often in many states are making minimum wage. In a lot of states, licensed addiction counselors are not making a great wage, but the wages go up a lot at this level. So be thinking about the master's level in this field. Now, given that, why does the field of addiction counseling exist? It's based on the belief that addiction-specific training can equip addiction treatment professionals to better serve clients than traditional counseling programs. So even though I say you need to be looking at licensed professional counselors, licensed clinical social work, the big advantage is these are specialists. Now, the other reason, and it's kind of a step, and what I believe is most people should start as addiction counselors and then get one of these levels. So, one of the reasons why the field exists is most traditional counseling training is, to be honest, it's by upper middle class people for, counseling upper middle class people. Whereas the field of addiction counseling provides street level training, and it has increased value on lived experience and practical practice over theory. Now, that isn't to say that anyone who gets an LPC is not going to be fully equipped, but it's just what's the difference? It's just, what's the difference between the officers and the enlisted in the military? There's a difference in focus. And the other thing is just traditional counseling programs, they don't have enough addiction specific courses. So to become a licensed professional counselor, usually you only need one addiction specific course. And a lot of those programs, they emphasize the theory a lot more over practice. So what is addiction counseling licensing? Licensing in the United States is done by each state. So most states will have a licensing model that they're building on the NADAC, so that's the National Association of Addiction Counselors, or ICN-RC standards, and they're going to require some combination of education hours, and typically City Vision courses can count towards, not necessarily in all states, but in many states, an exam, and City Vision's courses are aligned to help you pass that. Supervised practicum hours, you can use City Vision's practicum course, but then the work experience hours. So as an example, so this is Missouri. So we're licensed out of Missouri, but we can help get people in most U.S. states, and we have a list of those states. And so for Missouri, you have to have 180 education hours. Now, one course with City Vision is 135 hours, but the reality is in most states, you have to have certain hours in each of the 8 practice domains, and in some cases, other areas. You have to have 300 practicum hours, and we can help students get the practicum hours. But usually the big thing is you have to have a lot of experience hours. And the amount of experience hours in most states will change based on what level of education you have. So if you have a high school diploma, you need 4,000 supervised experience hours, where if you have a bachelor's, you only need 2,000. And then you have to take an exam. So most states actually follow the IC and RC exam. Some follow the NADAC exam. Now, after getting certified by your state, in most cases, most states, they call it certification, you can also go for a national level certification through NADAC or IC and RC. And usually they have significantly increased experience hours. That's more a resume builder. It's usually not required in the state. Now, SAMHSA, so that's the U.S. addiction framework, federal addiction framework. They have something that's called a career ladder. And often you'll see this, and we cover this in different courses. But, high school or GED, really that's focused on peer recovery support specialist or similar title. And then you get certificate programs, and then, different training programs. So in many states, you have the level 1, and it varies. Some states will require an associate, some only require high school. Usually most states for level 2 addiction counselors, you're required to have a bachelor's. And then the master addiction counselor, in almost all states that have it, they require a master's degree. Now, City Vision programs will help get you along the path for this. Now, so City Vision's programs, the addiction counseling programs, they're designed to build towards these different levels that I just showed you. So you can start with an addiction counseling undergrad certificate. You can go on for an addiction counseling associate, get an addiction counseling bachelor's. We have addiction counseling graduate certificate, and addiction counseling master's that's currently under review. And the idea is the credits from these lower levels will count towards the upper levels at the undergraduate level, and same thing with the graduate level. Now, we have aligned our courses with CACREP standards. We aren't CACREP, we aren't accredited by CACREP, but we have aligned them with those standards so that our students would be able to transfer, in particular, to Liberty's 60 credit LPC program. It's their clinical mental health program. And we're hoping that up to 27 credits from our 36 credit program could transfer to that. The advantage of this is you'd get a very addiction focused program, and our tuition is about 1/3 the price of theirs. So hopefully this is all helpful for you. If you have any questions, please ask your faculty member. Thanks a lot.